Hello everyone. While doing the clinical examination for the supraspinatus tendinitis, there are few specialized physical examination which is quite crucial to diagnose the supraspinatus tendinitis. This physical examination needed to be done, needed to be incorporated during the assessment procedures while assessing the condition of supraspinatus tendinitis, and that should be done just before doing any type of special test or before doing any type of ultrasound USG for that particular tissue structure. So we will understand today how and which all are the examination are most crucial to diagnose the supraspinatus tendinitis. So come, let us see. Myself Dr. Taposh, welcome to our channel Physiomass Organization. As we are continuing the educational series, and under the part of this educational series we are continuing the different orthopedic condition, and amongst that the most important repeated trauma of the shoulder joint, the condition is the supraspinatus tendinitis. Already we have discussed the causative factors of supraspinatus tendinitis, what are the painful arcs, what present during the supraspinatus tendinitis, and what are the other biomechanical relation like scapular dyskinesia with supraspinatus tendinitis. Today we will understand that which all are the specialized observational palpation or which all are mostly important examination technique before going to the any special test. While assessing the supraspinatus tendinitis, most often we ask the patient about their hobby or their occupation, and some of the times we came to know either it can be a traumatic, like they are holding any type of bus rail and suddenly there is a jerk and there is a sudden rotation, or like a occupation like they are a player, they are a sports player, badminton player, table tennis player, and during a backhand stroke, during a forward stroke, they used to have this injury. There's the supraspinatus tendinitis. So before we go to the final diagnosis, knowing the occupation of the patient is again very important, that give a clue that what it can be. Apart from that, the time we will palpate the area, we need to palpate just below the subacromial space, and that palpation either needed to be 0 to 10 degrees of abducted position or 90 to 110 degrees of abducted position. Take your thumb, just palpate the acromion process. As we know, the most prominent bony prominence over the glenohumeral joint is the acromion process. Just below of that is the subacromial space, and just below the passage of the supraspinatus tendon which inserts over the greater tubercle. So is to palpate exactly over here as a part of supraspinatus tendinitis, because this palpation technique again it's important. If someone is to have a bicipital tendinitis, they used to have an the anterior aspect of the pain, but this is exactly on the lateral aspect. So our palpation needed to be very prominent, that where we are doing the palpation, and it needed to be over here. Coming to the examination, we should do the active and the passive examination, passive range of motion of a glenohumeral joint. If it is frozen shoulder or adhesive capsulitis, both active and passive range of motion is restricted. But if it is supraspinatus tendinitis, the passive range of motion it will be full, although it will be painful, but the range of motion of 180 degrees of abduction it will be full. But the active range of motion it will be painful only in two region, mostly in two region, that is within a 0 to 10 degrees of the R or 90 to 110 degrees of R. So with this you can understand that it is can be a supraspinatus tendinitis, because if it is a frozen shoulder or adhesive capsulitis, there will be a restriction, there is a capsular pattern of tightness of a glenohumeral joint. Yes, late stage or chronic supraspinatus tendinitis may lead to frozen shoulder or adhesive capsulitis, but in the acute stage this diagnosis again is important, that which movement is restricted, active, passive or both. Coming to most important part, and few of the people, few of my viewers, few of my students, they used to ask me, sir, shall we do the MMT while assessing the supraspinatus tendinitis, because you are talking of this is a muscular structure, and if the muscular structure will go for any injury, of course that will be weak. I used to tell no. Now you might be wondering why I am telling no. The first and foremost important stage what you need to do for if you predict that it can be a supraspinatus tendinitis, that is the resisted isometric testing. So what's that? That's the resisted isometric. In our few of the last videos, I have already shown you that the grades of the registered isometric testing. You can go back and see all the gradings of registered isometric testing. Here I will show you how with and what are the points are there in the registered isometric testing. The first one is the weak and painful. The second one is the weak but painless. It can be the strong if it is a subacute condition or it's going towards a chronic. It can be the strong but it will be painful. But in a grade 4, that is it is strong but painless, that means it's a near normal. So those who are in this, they does not have any pathology to the supraspinatus tendon. So those either in this, we can guess that if it is grade 1 or 2, it both can be in the acute stage, and if it is a strong and painful, then it can be the subacute to chronic condition. So by this we can understand that. Now we will understand while assessing the supraspinatus tendon, what will be the position of the hand and how we will do the registered isometric testing for a patient, those who are having a impingement to the supraspinatus tendon. So to do the registered isometric testing, you cannot do everywhere. First things, it needed to be in anti-gravity position, that means the patient is in a sitting position, so it's better to make the patient to sit. And if this is the position of the patient, in 0 to 10 degrees of the arc or 90 to 110 degrees of the arc, ask the patient to lift the hand in a abducted position. Consider he is lifting the hand. You being the therapist or you being the assessor will give a resistance either in 0 to 10 or in 90 to 110 degrees of abducted position. So consider I am trying to lift the hand in abducted position. So in this position or in this position, just lift the hand passively and ask the patient from this position to lift the hand actively, and you being the another therapist or another clinician, you resist this movement giving a isometric contraction. Patient is to feel a pain or any one of the things what I have discussed earlier, and if that is positive, you can understand that you can grade the patient, either it can be a grade 1, it can be a grade 2, it can be a grade 3, or it cannot be a grade 4. So those who are in a dilemma that I will do the registered isometric testing or the MMT, I will tell never ever it's needed to do the MMT. Some of the times if it's a chronic condition and those who will develop the weakness of the supraspinatus muscle just because of the very chronic injury, you might by that time can do the MMT. But if the patient is having a only in a acute or a subacute phase, it's better not to do the MMT. Better you can do the resisted isometric testing. So with this video, we will understand that how and where to perform the resisted isometric testing for a condition of a supraspinatus tendinitis. So I hope you people understood about the examination procedures, although few of the other examinations also used to do, but the most important part I have discussed as a part of a physical examination. These three things is very important: the palpation technique, and also the examination under the examination as active and the passive examination, and also the registered isometric testing. Once we can gauge that what can be the condition, we will go to the special test. And if it is get confirmed with the special test, some of the times if the condition is worse, then we will go for the MRI or the USG of the localized tissue structure. But in the next video, I will show you which are the most important tests, which are the most important special tests, which is having the higher level of sensitivity and specificity while assessing the supraspinatus tendinitis and the procedures in detail. Till the time, I'll say goodbye. Those who are new for this channel, don't forget to subscribe this channel, and those who are watching this video, don't forget to like this video. I will show you all the detailed examination procedures of different orthopedic conditions of our body. So stay tuned with us, stay tuned with Physiomax organization. Thank you.